So these are going to be some models and microscope slides related to bone tissue and also the axial skeleton. So this slide right here, you should recognize this is compact bone. So you see the osteons, central canal. These are the lamellae going around, and the black dots represent osteocytes, and the little things that look like cracks would be the canaliculi. So you've seen that before. Moving over here, this is spongy bone. So what you're actually looking at, these little weavy things, these are the trabeculae of spongy bone. And in those spaces, we have bone marrow. All right, and then this slide right here is also bone. This is what they call decalcified bone, which is prepared for a microscope slide. And it just gives you a good view of the osteocytes lying in the spaces called lacunae. This is the microscope slide of the epiphyseal plate. And remember, this is the growth plate. So the different zones that we covered. So starting up here, we have the zone of resting cartilage. Just looks like hyaline cartilage. And then we get where it looks like the chondrocytes start to stack up a little bit. So in this region, that would be the zone of proliferating cartilage, and then it gets bigger. That would be the zone of hypertrophic cartilage. And then we have a zone of calcified cartilage, and then when it becomes bone, true bone, it's called the zone of ossification. So a couple things going on here. This is just a bone. This is not a human bone. This is from a cow, but if you look closely, you can actually get a good view of the medullary cavity, which has all the bone marrow. And then you see spongy bone. If you look closely, you see the trabeculae of spongy bone on the ends. So remember, at the ends of the bones is mainly where we have the red bone marrow, and the middle is more yellow bone marrow. Over here, this was an experiment that we usually do in the lab, but basically you take some bones, and by soaking some bones in either vinegar or some other substance, some acid-based substance, bone looks like this. So we'll say this is decalcified bone, and this is bone that's just been baked in the oven. So the purpose of this is to show you what the bone looks like if you do one of those things to it. So for instance, if we bake the bone in the oven, that destroys all of the collagen, but it doesn't do anything to the calcium. So the bone's still hard, but it's really brittle. It'll break really easily. And if you look at inside this jar, you can see the bone's broken into a lot of pieces. So remember, collagen gives bone its strength. Calcium gives it its hardness. So this bone that's been baked still has the calcium, so it's hard, but it's not very strong because it lost the collagen. Over here, we have decalcified bone, so it still has the collagen, but no calcium. So it's going to be strong, but it's going to be soft because it doesn't have the calcium. And so it'll be more rubbery in texture. So you can bend it, but it just won't break because it's still strong and it still has the collagen. Here's a model of compact bone and spongy here, but these are the osteons of compact bone that you've seen before. The rings are called concentric lamellae. We have the circumferential lamellae that go around the outside of the bone. Here's your periosteum covering the outside of the bone. We have the central canal in the middle of the osteon, so running up and down, and then we have the Volkmann canals running perpendicular to that. And then over here we have the spongy bone, and you can see the bone marrow in there. And these would be the trabeculae, the little spongy looking structures. So it's onto just some bones that we have models of. So this is the hyoid bone, which is found in the neck region. These are your hip bones. We'll come back and talk more about the hip bones with the appendicular skeleton. But the reason I'm just pointing it out now is because you can see the sacrum here, which is part of the axial skeleton. So looking at vertebra, this is C1, which is the atlas. This is C2, which is the axis. You can see the axis has its dens, and this is a pivot joint when C1 and C2 work together. So you can rotate and turn your head. These are thoracic vertebrae, stacking up, downward pointing spinous process. These are lumbar vertebrae, very thick, short spinous processes and very short transverse processes. So if we kind of separate them out, here is your atlas, which is C1. Here's your axis, which is C2 with the dens. This is just a regular cervical vertebra. So you see the transverse foramina, you see the bifid spinous process. This is a thoracic vertebra. You can see downward pointing spinous process. This is a lumbar vertebra. So very thick, short, very thick with very short processes. And here are those same structures lined up. So here's your sacrum and coccyx. So front view of the sacrum, this is the back view of the sacrum, this is your coccyx right here, your tailbone. So you got the sacral foramina, sacral canal at the top, hiatus at the bottom, you can see. So sacral canal here, sacral hiatus there. As far as the ribs go, here's just one rib by itself. So head, remember, attaches to the body of a thoracic vertebra, neck region. Tubercle is what attaches to the transverse process of a thoracic vertebra. Here's your angle, and then the shaft is the main part going back towards the sternum. And so here's what ribs would look like in the intact skeleton. If we zoom in a little bit, this is just kind of showing you the two pairs of floating ribs that we have that don't actually attach at all. So onto the skull models. So you can see this skull is nicely colored so you can see the different cranial bones that we talked about. So frontal, parietal, temporal. You can see part of the sphenoid right here. Here's the zygomatic bone. Frontal bone obviously right here in the front. Nasal bones here. And here's your maxilla. Looking at the back of the skull, you get to see the back of the parietal bones. Here's your occipital bone. Then when you get this view where you cut off the top part of the skull and you look down at it, you can see a couple of things that are really important. This little groove right here, this is the sella turcica, where it houses your pituitary gland. Here is your cribriform plate of the ethmoid bone, and this little part sticking up would be the crista galli. So remember all the little holes there are called the cribriform foramina. Looking at the bottom of the skull here, so this is the bottom of the maxilla, which forms the front of the hard palate. Here's the bottom of your palatine bones, forming the back of the hard palate. This is bones that are removed, so it looks a little different than it would in the intact skull, but this is an inferior nasal concha. Remember, they help spin the air as the air comes into the nasal cavity. This L-shaped bone right here is palatine bone. So this is the palatine bone, the bottom of it, and this is what it looks like if you took it out, so L-shaped. And here's one of the maxilla, forms the upper jawbone. And then sphenoid bone looks like a butterfly, so you can see the wings, so greater wings, lesser wings. Here's the pterygoid processes going downward. And then like looking at the top, you see the sella turcica there. Again, this is a sphenoid bone separated from the skull. And you see lesser wings and greater wings. Looking at the mandible, so here's your mandible. A couple of things to point out. So mental foramen right here. That's the little hole right here in the chin region. The mandibular foramen is on the inside here. So lastly, looking at the fetal skeleton. So a couple things, this is the fetal skeleton. So a couple things about it. It's mainly hyaline cartilage. So remember, most bones are formed from a hyaline cartilage model. So you can see the face is relatively small in proportion to the skull. The ribs kind of stick out forward a little bit, which is common in the fetal skeleton. And also, look, the vertebra, it does not have the curves that we see in an adult, so it's really straight. All right, and the overall head is relatively big compared to the body. So lastly, I want to just show you this. This is a model of the auditory ossicles, so the three bones that we have in each ear that allow us to hear. So this is the malleus, this is the incus, and this is the stapes. So the stapes, remember, looks like the little stirrup that you could put your foot in. So malleus, incus, stapes.